Primary healthcare is what we will be talking in today's video. So yes, PHC is equally valid in every country, although it takes various form, various shapes, and various manifestation in each of them. The concept of primary healthcare has been accepted by all countries as a key to attainment of HFA, health for all. It is accepted as an integral part of country's health system. The components, or should I say the elements of PHC, the primary healthcare, all the specific service provided will vary in different countries and communities. The Alma Ata Declaration has outlined only 8 components of PHC, the primary healthcare. The first is the health education concerning prevailing health problems and methods of prevention and controlling them. Second is the promotion of food supply and proper nutrition. The third, an adequate supply of safe water and sanitation. The fourth, very important one, is a maternal and child health care. The fifth one is the immunizations against major infectious diseases. Sixth one is the prevention of control of local endemic disease per se. The seventh one is the appropriate treatment of common diseases and injuries. Last and the eighth one is the provisions of essential drugs. Provisions of essential drugs being made available to the general public. So the 8 elements are been basically segmented into 3 categories. The first 3 elements are promotive services, the middle 3 elements are preventive services, and the last 2 elements are curative services. So yes, promotive services, preventive services, and curative services. The concept of PHC involves an effort to provide the rural population in developing countries with at least the basic minimum of health services. The list can be modified to fit the local circumstances. In fact, it should be modified every now and then. For example, some countries have specifically included mental health as a part of your PHC, and majority of the countries have not done so. In fact, the most populous of the countries have not done so. Physical handicaps as a specifically included in certain countries as a PHC providers health and social care of the elderly. Again, these are the exception, and there are many countries which might include or might exclude these list of mental health, physical handicap, and elderly people's health and social care. The mentioned 8 services indicated as elements are to be organized, delivered on the basis of the principles of equity in distribution, appropriate technology, multi-sectoral approaches, community participation as the case might be. Let me discuss those 4 points. The first being the equitable distribution. The first key principle in primary healthcare strategy is equity or equitable distribution of health services. Health services must be shared equally by all people, irrespective of their ability to pay. Equitable distributions. PHCs aims to readdress this imbalances by shifting the center of gravity of the healthcare services from cities, where 3/4 of the health budget is spent, to rural areas, where 3/4 of people live. So basically, you are shifting majority of the health services from urban areas to the rural areas because where the population is located. Bring this services as near as possible to the people's home. Remember, equity means service to all. Remember, equity is all about more services to the needy and to the vulnerable section. And that is while continuing to provide essential health care for all populations, irrespective of the social, economical, and cultural preferences. Extended care is to be provided to the high risk groups in community, within the health centers, or by referral from the health centers to a higher level of care in the hospitals per se, as the case might be. What we are looking forward to for ensuring equity, the populations to be served must be known, must be much visible. The vulnerable groups are to be identified and should be reached at a hand's distance. We'll talk about the equity in distribution for ensuring equity. The health services and need not necessarily the centers of health we are talking about have to be dispersed into this. Health service has to be distributed, not the health centers. To the furthest remote rural area, the deepest part of the undeserved population, urban population. The failure to reach the needy, the majority is usually due to the limited geographical access, as the case might be. Thus, to ensure equity, Accessibility has to be improved by increasing the number of health facilities as on when on basis, improving the transportation condition thoroughly, organizing outreach services, thus substituting one when the other is not available. Equity in distribution. PHCs aims to correct these imbalances in accessibility, bringing health services as near to the people's home as possible. To achieve this, PHC is supported by higher level of healthcare to which patient can be referred for an extended care as on when on basis. How do we go across with it? Community participation, involvement of the individual, families, and communities in promotion of their own health and welfare. This is what the community participation is all about. There must be a continuing effort to secure meaningful involvement of community in planning, in implementation, maintenance of the health services, evaluation of the health services thereby. So maximum reliance on the local resources such as the manpower, money, material should be noted out there. That is what we are looking forward to it. Community participations, universal coverage by PSC, the primary health care cannot be achieved without the involvement of local community. In short, primary healthcare must be built in on the principle of community participation or perhaps even on the involvement. Intersectorial coordination. There is an increased realization of the fact that the component of PHCs cannot be provided by the health sector alone. This is not only a fact, but it is also been realized by the government across the globe. So this increased relation, that component of PHC, primary healthcare, cannot be provided by health sector alone. So we need to have cross participation, or should I say intersectorial coordination. The declaration of Alma Ata states that PHC involves the additions to the health sector, all related sectors, aspects of national and community development, in particularly to agriculture, animal husbandry, food, industry, education, housing, public works, communication, and various other sectors per se. Appropriate technology, definition being the technology that is scientifically sound, that is adaptable to the local needs and acceptable to those whom it is going to be applied upon, though for those whom it is used, and that can be maintained by the people themselves in keeping with the principle of self-reliance with the resources of the community and the country can afford, and that is what we are trying to address. Appropriate technology, health technologies are required not only for diagnostic maneuvers, therapeutic maneuvers, but also for disease prevention, disease control, and health promotion thereby. This is what we are looking into it. Though it is commonly perceived that the person who is going to apply it is trained altogether as the process might be, technology may have to be applied by individual, by family members, by the community. Use of toothbrush, let's say, eyeglasses, domestic water filter, domestic pest control. So technology is applicable for everybody's use as on when on basis, and we will like to go across with it. So that is what appropriate technologies has to be. Remember, technology for individual, for family, for community. Example, the use of toothbrush, eyeglasses, domestic water filters, domestic pest control, and so on and so forth. Let me talk about the technology. So the simplicity is the fundamental root of technology. That is all that we are looking forward to. Example of such as ORS, the diarrheal disease control of taking liquids with essential minerals and vitamins, breastfeeding in spacing, and weighing for growth monitoring, etc. Even the height monitoring can be measured around here. So that is what we are looking out as far as PHCs are concerned. With this, I come to an end of this video. Thank you for watching it.